Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Phenytoin. Phenytoin is the most commonly used anti-epileptic drug is phenytoin. Phenytoin is a sodium channel blocker. It will inhibit the depolarization shift and it will also inhibit both the origin of the seizure activity and it will also inhibit the spread of the seizure also. It will inhibit the origin of seizure and also the spread of the seizure activity. It is useful in maximum electroshock model. It is useful in maximum electroshock model. Then uses of phenytoin. Phenytoin can be used in generalized tonic clonic seizures. Okay, it is also used in post traumatic epilepsy and also in partial epilepsy. Then in the phenytoin we have one drug called as phosphenytoin. This phosphenytoin is actually a water soluble prodrug of phenytoin. So because it is a water soluble prodrug of phenytoin, this phosphenytoin can be given IV. It is an antiarrhythmic drug also. This phenytoin, actually, one important thing is this phenytoin can be used for tonic, generalized tonic clonic seizures, post-traumatic epilepsy, and partial epilepsy, but it is not effective in one type of seizures, that is, in absent seizures. The phenytoin is not effective. Then, pharmacokinetics. Pharmacokinetics, the phenytoin is well absorbed orally and food may delay absorption of the phenytoin. Phenytoin is almost 90% protein bound and there are pseudo zero, it follows pseudo zero order kinetics. The phenytoin is metabolized by hydroxylation and it has a half life of around 15 to 30 minutes. Metabolism of phenytoin is actually it is inhibited by a drug called as isoniazid. Phenytoin is a potent enzyme inducer. Then, side effects of phenytoin. Phenytoin at therapeutic doses it has few side effects. At therapeutic doses, the most common side effect of phenytoin is actually gum hypertrophy. Is the most common side effect of phenytoin, which is seen in around 30%. It can also cause hirsutism or osteomalacia is seen. Osteomalacia is mainly seen due to the decreased vitamin D with vitamin D and calcium absorption. Because of decreased vitamin D and calcium absorption or due to vitamin K inhibition, it causes osteomalacia. Then it also causes megaloblastic anemia, mainly due to the folic acid deficiency will cause megaloblastic anemia. Then there can be Hodgkin's like illness is seen in these patients. This is called as paracortical hyperplasia is seen. Then there is diagnostic confusion is seen in thyroid function tests if the patient is taking this phenytoin. If the patient is taking this phenytoin, diagnostic confusion in thyroid function tests has been reported. Then we have a syndrome. Phenytoin can cause a syndrome called as fetal hydantoin syndrome. In fetal hydantoin syndrome, the child will develop with the fetus will present with cleft palate and hypoplastic phalanges. So as a result, it is actually it should be avoided in pregnancy because of this fetal hydantoin syndrome in the baby. So these are the things that occur at therapeutic doses. At toxic doses, phenytoin can cause the following symptoms. At toxic doses, phenytoin can result in diplopia, It can result in nystagmus, and ataxia can occur. Okay, so these are actually dose dependent, and these occur in the beginning. At higher dosage, sedation can occur mainly at the higher dosage. The phenytoin can cause cerebellar atrophy, and it can also cause neuropathy, and it can cause vascular thrombosis on injection. Phenytoin can also cause gangrenal hyperplasia. Sorry, it can cause gangrene, hyperplastic. So if phenytoin does not cause gangrene, it actually causes, phenytoin will result in gum hyperplasia. So phenytoin will cause gum hyperplasia also. These are the side effects that occur at toxic doses. That there are some rare side effects are also seen for phenytoin. Rare side effects are, it can cause interstitial lung disease can occur. It can result in gynecomastia as a rare disease. And one more rare side effect of phenytoin is it can cause pure red cell aplasia, can occur due to phenytoin. Now, because you have all these side effects, but when do you actually stop phenytoin? Phenytoin should be stopped if the patient experiences any hypersensitivity reactions, or if the patient is put if the and first you should stop the phenytoin. If there is hypersensitivity reaction, then stop the phenytoin, and you should replace phenytoin with an anti epileptics, like again carbamazepine or sodium valproate can be used to, or sodium valproate can be used instead of phenytoin. Then, therapeutic level of phenytoin. The therapeutic level of phenytoin in epileptic patients is around 10 to 20 micrograms per ml.
Thank you and thank you for watching.